A review on the causes of avascular necrosis. Let's start the story with a scientist who wanted to help a patient with sickle cell anemia. Sickled red blood cells can occlude the vasculature of bones, where the hip is the most common site, but can also occur in the shoulders and knees. AVN can show a crescent sign on X-ray. Sickled red blood cells happen to have the same shape, just like the crescent on X-ray. Now the scientist felt really sorry for the young man, as he was wrongly treated with steroids for his joint pain. Unfortunately, chronic use of steroids may worsen AVN or even cause AVN. The scientist questioned himself how he could help. The question marks help you remember idiopathic unknown causes of AVN. So he went home and tried experimenting. And he screamed out, "Gosh! I may have discovered something to treat this young man." Remember, Gaucher for Gaucher's disease, which is a lysosomal storage disease associated with avascular necrosis. Gaucher disease comes with Erlenmeyer flask deformity of the femur. This flask here can remind you of the Erlenmeyer flask deformity. In Gaucher's disease, the scientist was so excited about his discovery, he decided to celebrate and go to the pub. He was drinking alcohol with all his friends, and incidentally, chronic alcoholism is also a cause of AVN. In celebration, he was high-fiving all his friends and celebrating. High five in the story indicates HIV. HIV is another cause of AVN. Now, this scientist was happy after his celebration and left the pub, but he was a little bit tipsy. He stumbled on a red rock. The red rock here indicates a thrombosis or clot. A blood clot would disrupt the vasculature of the femur and cause necrosis of the bone. He stumbles over the rock and falls to the floor. Trauma, such as a fracture or dislocation, can cause AVN as well, which may happen months after the injury. And ironically, AVN occurred with this poor scientist. And if bad enough, it may necessitate decompression surgery. And these are the main causes of acute vascular necrosis.